In this video, we'll learn about KF ring, otherwise called Fleischer ring. Here, you can see there is a brown ring present around the cornea. So this is the cornea, this is the sclera. At the junction between the sclera and the cornea, which is called as limbus, we can see a brown ring. And this brown color is due to deposition of copper in the cornea. We know that copper wires are brown in color, right? Similarly, now when copper is deposited in the cornea, it gives a brown color. Now, in which layer of the cornea does copper get deposited? We all know there are 5 layers of cornea from anterior to posterior aspect. If you see, anterior epithelium, Bowman's membrane, corneal stroma, Descemet's membrane, and endothelium. Out of these 5 layers, copper gets deposited in the Descemet's membrane. So the fourth layer, the copper is deposited. To understand a little bit about this KF ring, we should know about copper metabolism. The main source of copper is the nuts, seeds, and seafood. And the absorption of copper, once we consume all these nuts and seeds, no, it happens in duodenum or early part of jejunum. Once it is absorbed from the intestine, now the copper will move along with ceruloplasmin. It's a transport protein. The first organ, the portal vein, no, drains into his liver, right? So all the tissues in the body will get this copper, but the main organ to receive this copper is liver for storage. And once it is stored in liver, now remember, when it is like when it exceeds the storage capacity, what happens is the copper is excreted in the bile and very little in urine from kidney. So, but remember, the utmost important route of excretion of copper is via bile. And for transporting copper in the blood, we need ceruloplasmin as a transport protein. And for excreting copper in the bile, we need a protein called as ATP7B protein, which is present in the hepatocytes. Okay. Now, as just to summarize what I told till now, once we consume seeds or nuts and all, what happens is the copper will be absorbed in the early part of intestine. That's nothing but duodenum and early part of jejunum. And this copper via portal vein goes to liver. And in the liver, copper is stored. This copper, whenever needed, it will be released into blood and it will be transported along with the ceruloplasmin, which is nothing but a transport protein for copper. But when it is in excess, copper will be excreted via bile. Remember, bile is the main route via which copper is excreted, and the protein which is required is ATPase 7B protein, which is present in hepatocytes, which will pump out this copper. Now, in Wilson's disease, you all know we find this classical KF ring. Wilson's disease is nothing but it is a hepatolenticular degeneration where the copper metabolism is affected. So, what exactly happens in Wilson's disease is there is a mutation in the ATP7B gene, and this is the gene which actually codes for ATP7B protein. And as I already mentioned, this protein is responsible for transporting excess copper into bile for excretion. So now when this transport protein is defective, what happens is there is a excretion of copper becomes defective. So the defective protein fails to properly transport copper into bile, leading to copper accumulation in the liver. So when copper accumulates in the liver, what happens is once the storage capacity of liver is exceeded, this copper will start spilling into blood. This excess copper now moves to different organs like brain, cornea, and kidney. In the brain, it will produce symptoms like tremor, some personality changes, movement disorders. In the eye, it will present as KF ring. In the kidney, it can usually form kidney stones, or sometimes the Wilson's disease patients can suddenly develop acute renal failure also. So as I mentioned already now, the copper when it becomes excess and when it is not getting excreted properly in bile, as happens in uh, Wilson's disease, this copper will start getting released into blood and it will go to various organs and cause a classical symptoms of Wilson's disease. So now how do you investigate? Normally in our when we take a liver sample biopsy and you check the amount of copper level, okay, per gram of dry weight of liver, normally we find about 15 to 55 micrograms of copper. But in Wilson's disease, remember it will be more than 250 micrograms of copper per gram of dry weight of liver. Now, any differential diagnosis for KF ring if you want to think of? Remember, it will be arcus senilis because this is most commonly seen in elderly patients because of excessive deposition of cholesterol or lipid, giving a white ring appearance. Now, in KF ring, as I mentioned, the Wilson's disease can present between the age of 5 to 35 years, and it is classically a brown ring, and it is because of copper deposition, right? But in arcus senilis in elderly patients, what we see is a white ring. And the KF ring actually starts from the superior pole of the limbus or nothing but the cornea, upper part of the cornea. But arcus senilis typically starts from the inferior pole of the cornea. Thank you for your listening. If you like this video, please like, share and subscribe.